So fibrinolysis has been shown to be inferior to PCI around 20 years ago in 2003. Can consider an NSTEMI with symptom onset less than 12 hours if first medical contact to device time is anticipated greater than 2 hours, so essentially more rural areas. Fibrinolytics, of course, contraindicated in active bleeding, increased bleeding risk, especially intracranial hemorrhage, and contraindicated in suspected dissection, ischemic stroke of less than 3 months prior because of concern of hemorrhagic transformation, and in patients with severe hypertension. Door to needle is ideally less than 30 minutes. Some of the agents, TNK, that's the most common, but you also have streptokinase, alteplase. Adjuncts, you can also load, of course, with aspirin 325, and you can continue 81 day prior, and Plavix as well, 300 milligrams loading dose, and continue 75 day after for at least 14 days to 1 year. So similar to patients undergoing DES placement. Okay, and you know, these patients with STEMI and NSTEMI undergoing fibrinolysis should be anticoagulated with therapeutic Lovenox or heparin for 48 hours. Okay, and it looks like we still have time to begin talking about risk stratification for PCI timing. So there's multiple risk models, essentially calculators that you can find on MD-Calc, the GRACE and TIMI score. The GRACE score is based on predictors of 6-month mortality, and it includes factors like age, heart rate, systolic blood pressure, patient's creatinine, cardiac arrest at admission, and the troponin levels. So there are 4 subgroups which we can quickly talk about. For urgency to revascularization, the very high-risk patients, immediate invasive within 2 hours. So these are patients with NSTEMI or unstable angina that are, refractory or recurrent angina despite multiple, anti-anginal medications or hemodynamic or electric instability. So these are very high-risk patients with NSTEMI that should undergo PCI within that 2-hour time frame. So next up, we'll be talking about the different risk levels and adjuncts to revascularization as well, which we briefly touched upon earlier.